46-year-old, 5'6" 325-pound female. She's involved in an MBA.
Okay.
She's got no past medical history.
Okay.
She has a head injury due to contact with a tree.
Okay.
She is now febrile, has a GCS of 5. Her heart rate is 118. She's got a respiratory rate of 5.
Okay.
Breath sounds reveal inspiratory crackles in bilateral lower lobes.
Okay.
An AVG was drawn, and the results are as follows: a pH of 7.18, PCO2 of 62,
Okay.
PaO2 of 58, bicarb of 24.
There we go. Okay, what? Bicarb of what?
Bicarb of 24.
24, okay. Okay, what was the PO2 again?
PO2 was 58.
58, okay. So she's in respiratory acidosis with moderate hypoxemia, and I'm going to put her in volume control. With a head injury though, I really want to put her in pressure control, but I'll put her in volume control because I want to control her minute ventilation and her PO2. So I'm going to put her in volume control. I'm going to set my volume at her limits because of her height is between her low is 355.8, her high is 474.4. So I'm going to set her tidal volume at 400. I'm going to give her 100% O2 due to the trauma and because her PO2 is a moderate. I'm going to set her inspiratory rate at 1. Frequency at 15, her max pressure at 30, her flow at 40, and her PEEP at 5. And I'm going to go ahead and do my alarm limits. So she's doing a 6.04 for minute ventilation right now, so I'm going to set that 2 to 3 above. So I'll do it 8 and 2 below. For pressure, I'm going to set at a max 35. For tidal volume, I'm going to set it 100 above, 100 below. It would be 5, which would be right in with her high tidal volume. I'm going down. Yeah, and I set the alarm off. Go back. Okay, perfect. Frequency, she is breathing, I've set at 15, so I'm going to go to 25 for high. That's 10 above, 10 below, not below 8. And apnea alarm, I'm going to set at 20 seconds. Okay, and now I'm going to start her ventilation. See what she does.
It's going already.
Oh, okay, so get out of there.
Okay, so now she's set up and going. So go ahead and do a vent check.
Okay. So I'm in CMV. So these are my set respiratory rates. So 15, I'm playing 400. Pressure control, I don't control pressure in this mode because it's volume. Pressure support, I don't control. T inspiratory is 1. Flow is at 40. Rise time, we don't have a rise time. We go to data. So, inspiratory, these are my settings. So I don't have a rise time in this. No rise time, which should be slope also. PEEP is at 5, FiO2, I put it at 100%. IE ratio is at 1 to 3. And trigger sensitivity. Trigger sensitivity. Where do I Oh, here. Frequency trigger? No. There's no. It's 0. We go into another screen. Okay, let me go to table. Okay. Okay, so then my patient parameters, peak inspiratory pressure is going to be the 22. Plat is 20. Mean airway pressure is 9. Peak is 5. Respiratory rate, I set the respiratory rate, so it's going to be 15. They don't have a spontaneous respiratory rate. Their end tidal volume is 401. I set it, so they don't have a spontaneous. Minute ventilation is 5.98. And for compliance, I have to do I would just minus, for compliance, I minus the tidal volume, their set tidal volume, minus the, do the inspiratory hold. So I'll get out of here, do my inspiratory hold. Let go, and then I freeze my screen. I go back to my top of my plateau. I get 21. That's for my peak airway pressure. So 21, and my plat is 20. So then I would take my plateau minus my PEEP divided by my tidal volume. So plateau minus PEEP. So my plat is 20 minus my PEEP is 5. That's 15 divided into my tidal volume of 400. That's 3, that's 2, that's 30. 115 goes into 100. What is it? 40. No. So it goes in 7. 35. No. 21. 6. 30. 79. That's 90.
That's good enough.
So 26. So my lung compliance is at 26. It needs to be below 30, above 30. And my raw would be my PIP minus my plateau divided by flow. So my PIP, my peak is 22 and my plat is 20, so that's 2. So there is no airway resistance. I don't have a real patient, so I don't do that. Then I go into my alarm settings, and my apnea alarm is set at 20. My frequency is set at 25, no lower than 8 on my low. Tidal volume is at 500. Low is at 300, but I can't set it. But that's what I would set it if I could. Minute ventilation is 8 for high and 4.80 for low. My high pressure alarms 35. My low pressure 20. 10. And I can't set my PEEP high and low on this.
Okay.
Okay.
So.
All right. So 2 days later, right?
Okay. 2 days later.
Nope. Have her. So give her that ABG.
Okay.
Okay.
So after all your vent changes, you do get this ABG back.
Okay.
It is 7.49.
Okay.
CO2 of 30.
Okay.
PaO2 of 94.
Okay.
And a bicarb of 23.
Okay.
With an SaO2 of 100%.
Okay. So I would go ahead and I would turn down my O2 for 40%. 40. I'm gonna lower my frequency to, I'm gonna go to 12. Because now they're alkalotic. Okay. And I'm gonna leave everything else the same. I'm gonna see how my patient's doing.
Okay, don't do another vent check. So next, you have 2 days later.
Okay.
Your patient is on the following vent settings: ACVC with a rate of 22,
Okay.
a tidal volume of 750,
Okay.
PEEP of 5, 60% FiO2.
Okay.
Vital signs are as follows:
Okay.
heart rate is 148,
Okay.
blood pressure is 78/41,
Okay.
SAT is 85%.
Okay.
You have an audible PIP alarm
Okay.
and an expiratory tidal volume low alarm.
Okay. So,
So,
want me to tell you what's wrong with this first?
so I want you to suggest diagnostic and therapeutic procedures to determine and treat the cause of the patient's deterioration.
So I have a high pressure alarm, PIP, okay? So high pressure alarm is probably because the compliance of the lungs has gotten worse, maybe more fluid.
So I don't want to hear probably. I want you to
okay.
suggest diagnostic and therapeutic procedures to determine what caused it.
Okay, so probably because the tidal volumes are too high. Tidal volumes are too high. Frequency is...
You're giving me probably again. I want you to tell me how are you going to diagnose or suggest diagnostic and therapeutic procedures to determine and treat the cause of the patient's deterioration.
Okay, so first I would most likely suction the patient.
Okay.
Then I would...
You don't get anything out?
Okay, I don't get anything out. So I would check their cuff pressure.
Cuff pressure is fine.
Okay, I would check for, I'd do an x-ray, check for a pneumo.
Okay. How else can you check for a pneumo?
By listening to breath sounds.
Okay, so you have,
to see if there's diminished
you
or
have
decreased breath sounds.
absent breath sounds on the right hand side.
Okay, probably a pneumo.
Okay.
It is a pneumo.
So how would you treat a pneumo?
Call the doctor and tell him to put in a chest line
Chest
reinflate.
tube?
Yep, chest tube to reinflate the lung.
Okay.
And I would lower the tidal volume.
So the next question is...
Sorry.
The next question is suggest appropriate ventilator adjustments.
Okay.
So
I'd lower their tidal volume to their ideal body weight.
Okay.
I would decrease their frequency of breaths because they're at 22 frequency. I would lower the FiO2 to 40 because their SpO2 is at 80. Maybe not 40. I'd probably go to 50 on the FiO2 because the SpO2 is at 80. I want it above 90. Their blood pressure is low. Their heart rate is fast. So with the oxygenation of this patient, it should take care of, and the correction of the pneumo should correct the heart rate and the blood pressure. And the PEEP, increased pressure. I would leave the PEEP the same.
Okay. All right, so 10 days later,
Okay.
the patient is on the following ventilator settings.
Okay.
She's on a pressure support CPAP mode, pressure support of 10, PEEP of 5.
Support 10, PEEP 5. Okay.
FiO2 is 25%.
Okay.
Vital signs are as follows. Respiratory rate is 14.
Okay.
Heart rate is 78.
Okay.
Blood pressure 125/70.
Okay.
SAT is 97%.
Okay.
So I want you to provide key lab values and related tests that you will use to determine the next step of care for the patient.
Okay, everything seems in normal limits to me as far as respiratory rate, heart rate, blood pressure, and SAT. So I would try and put the patient on room air at 21%. I would do an ABG to see what their blood oxygenation is. And then pressure support I would leave at 10, PEEP I'd leave at 5, They are in CPAP, which is an oxygenation mode, and spontaneous. So I would leave that. I do an ABG, do another chest x-ray, and see where we go from there. Listen to breath sounds, see if there's any clearing.
Okay, so next is provide all tests related to the weaning process.
Okay. So weaning process is when we're going to try and get this patient off the vent.
Okay.
So we're going to leave them in the CPAP mode.
Okay.
As long as possible. We're going to lower their pressure support, probably down to 6. Therapy, we'll leave it 5. We'll put them on room air, and we'll do trial runs. After 30 minutes of being on the weaning process, we'll do another ABG, and we'll just monitor the patient, see how well the patient is handling, you know, look for the work of breathing, if it's increasing, if they're not pulling the correct tidal volumes to maintain the correct oxygenation, then we would put them back onto a assist mode with more pressure support just to allow them to rest until